In terms of specific cases, I've treated, done this for numerous patients. There's different ways of looking at it now that we have the availability of plasma cell-free DNA as well as tissue-based molecular testing. So in one case I could think I have a patient who was in her mid-40s who was on afatinib for about 11 months and then developed some new small pulmonary nodules, and we discussed about, well, do we think about switching now, or do we get a follow-up scan? And because it was hard to tell how much progression there really was, we obtained a follow-up scan a few weeks later, and there was clear progression. And she was starting to have a little bit of symptoms before being completely asymptomatic. So I had ordered cell-free DNA testing initially because she was there in clinic. She was familiar with the test, being very active in the lung cancer patient advocacy community. And so we had sent that off, and it came back negative for both T790M and actually the activating mutation as well. Likely a false negative. We proceeded rapidly to get a tissue biopsy and get molecular testing that showed an EGFR T790M mutation, and she's now on osimertinib doing fantastically well.